Welcome back. We're looking forward to another wonderful session with you all again today, this time focused on building a trauma-informed coalition. We know that there is strength in numbers when it comes to social movements. Does not reduce the importance that any single person can have, but when we look at successful movements that create lasting change in both big and small ways, so frequently we see groups of individuals who work together to what we refer to as coalitions. Like we said during our last session, healing happens in the context of healthy relationships over time. Advocacy work can be difficult at times, and though we know it's so incredibly rewarding, and so working with a group rather than alone can really help us through those challenging times that come up. This is why we work to build those trauma-informed coalitions. So we will also be taking what we learned from the first session and applying it to how we think about building our coalition. We know that the last session was a lot of content, and today there will be more opportunities to connect with others in the group to discuss how this group can really strengthen its coalition if you already rallied around something and combine that action, or how we can begin to form. As we begin today's session, I want you to think about a group or team that you've been a part of before, or that you're a part of now. We will talk about what we want to see as we form a coalition to mobilize around, and pulling from what worked well and what could have gone better from our past experiences can really help inform those decisions. Coalition building is the process of bringing together those diverse individual groups and organizations to really work toward a common goal, usually related to some type of social change. It relies on a collaborative network that really is able to amplify the impact of individual advocacy efforts. And so coalitions can be seen as living systems where that journey consists of everyone coming together where they can learn and where they can grow together. As we dive into developing a trauma-informed coalition, a great place to start is with creating what are often referred to as community agreements. These are expectations set by the group where people hold themselves and each other accountable to create conditions of empowerment and safety within the group. As you see here on this slide, a sample of community agreements that we can work from. These will not necessarily be the community agreements that you use for your group, unless you all just agree to adopt them. But we hope that you will take what you want, remove what you don't like, and add in other ideas that are important for you to ensure that you form a coalition that there's brave space for all of you. This will be important because during today's session and moving forward, we'll be doing work in small groups and want to ensure that we are creating conditions of empowerment and safety for everyone. These agreements are not set in stone, and they can continue to be developed over time as we continue, but we wanted to really get started with them today. So let's take a minute to reflect on what's important to you, and then we'll take about 10 minutes to brainstorm as a group what community agreements are important to us. And then we'll look and see how we can form that into this coalition building. Feel free to use the community agreements on the screen for inspirations as you brainstorm what those ideas might look like. We'll pause the video here and we'll wait for about 5 to 10 minutes, and then we'll come back. Okay, now we're back. Now that we have community agreements, let's talk about building power. Successful models of advocacy work to bring together different groups working on similar problems and combining their efforts to really achieve even more powerful results. Think back to Module 1, where we talked about how trauma-informed approaches rely on collaboration. Advocacy also links closely with empowerment and voice and choice, another principle we discuss. And of course, as we build a trauma-informed coalition, we are embedding peer support throughout, which is why we started by working through community agreements to really assure that all of us are supported in our efforts. As we get started, we want to keep in mind that change takes time and effort. And so by working as part of a group, we are less likely to burn out and stop working toward this important change we are looking as we move forward. At times, advocacy can feel like we are pushing a boulder up a hill. It is a lot harder to maintain that push when we are doing it alone. Sometimes we may need a break, and having others help us continues to build that momentum and at least not losing ground we've gained, as well as making that boulder lighter altogether. I believe in the change that each of you can make on your own. However, it is important to recognize your own power as an individual, but just as important to recognize the power of a group that's building a network of support that's working towards something together. This can be a balance where if there is something you are passionate about changing, recognizing that nothing is stopping you from working on that and having a coalition that can support you, whether that be getting involved alongside your lead or just cheering others on, is incredibly important. Last session, we talked about trauma and trauma-informed care. Now, let's dive deeper into building a trauma-informed coalition together. Identifying a common goal does not mean we can only do one thing, but having a purpose for coming together and what we hope to address helps to create that guiding star that keeps the group together and being able to move forward. Many organizations develop mission, vision, and value statements, and these can take a lot of time and thought. And so we will not promise that we will be able to get there in this session alone, but we'll begin the process of identifying a common goal that we are working towards as a group. As we work to frame this goal or goals, we want to work for it to be clearly framed in a way that resonates, that can be understood with those outside of the organization as well. The broader and more inclusive framing, the more individuals and organizations can potentially align themselves with it. However, it's also fine to have a smaller organizing goal, as it can be less daunting on individuals. There are strengths and weaknesses and different approaches, and no single way to do it. What is important is that we develop a common goal from the beginning. And this will help us get through those difficulties that may arise, as well as attract others to join the group over time. We'll get into this a little bit more as we begin to move forward in this session. But before we do, we'll highlight some other key considerations for building a trauma-informed coalition. First, engaging those key stakeholders. So we've already started this process as there are a group of folks who are really planning to work together. However, we talked about building power, and there are strength in numbers when there's alignment. So we don't need to grow the group to be successful, but we want to consider if there are other ways, there are other individuals that can help us mobilize and achieve the change that we're working toward. Ideally, coalition members will represent diverse backgrounds, perspectives, and experiences. Young people bring unique and diverse perspectives to trauma-informed conversations, which is why we feel this series is so important. Yet, we know that there is incredibly diversity among the backgrounds and experiences of young people as well as adults. We want to consider if there is an individual or other groups that we want to engage and how to bring them in as part of the coalition. And that kind of goes back to having that mission, that vision, and those values, which can really be important here. As we work to build out a diverse and inclusive coalition, one thing to be mindful of is to not tokenize any individual. Tokenizing is when a single person's perspective is made to represent the perspective of the entire group. We want to ensure that we are honoring individuals for their unique experiences and working toward diversity and inclusivity beyond just a single person within the group as best as possible. It can be helpful to map out different stakeholders in the project that you're pursuing. And so let's use advocating for recess as an example. Who all will be impacted? Well, we have students, of course, who would get to have recess time during the school day. We have teachers who will also be impacted, as their time in class would likely have to be reduced to make time for recess. This will then require involvement from school administration, who set the schedules and assign the space to be used. And in using that space, even custodial staff at the school are likely to be impacted in some ways as well. This here is just a simple example, but we can see how mapping out an exercise to think about who exists within the school community and who might be impacted by our advocacy is important, as we can work to engage with diverse stakeholders while we begin to move forward. have to continue by building that trust in those relationships. Trust is foundational to coalition building. It's important to foster an environment where members can openly share their ideas, their concerns, and their expectations. When individuals feel heard and respected and have a sense of belonging, they are better able to share their stories, they're better able to heal, and they're better able to help lead. There's a well known saying that trust takes time to build, but only a moment to break. It is important that trust building is seen as an ongoing process that builds upon itself over time. We know that trauma can disrupt our ability to trust and can affect the ways that we feel about other people, ourselves, and the world around us. And so, trust based relationships enable a collaborative process. We obviously want to build trust based relationships with each other in the coalition, but also want to think about how we build trust based relationship with those we are advocating to as we work together towards that change. Some small steps that can be taken to increase trustworthiness in our advocacy is to be transparent about what is known and unknown, and what we hypothesize to be true versus what we know to be fact, and being authentic and transparent. In addition to doing these things to build trust, it can also help to communicate in ways that lets others know that we are expecting what we are expecting of them while working together, and explaining why certain decisions were made if and when necessary. Within your coalition, giving choices, how different personal stories are collected and how it's shared, and being able to seek that information and being able to distribute it out amongst other individuals. That helps to build that trust. In addition to trust being foundational to coalition building, relationships are critical to coalition building as well. And relationships and trust, well, they both go hand in hand. As we said before during the first session, and you can be sure we'll say it again and again, healing takes place in the context of healthy relationships. And so, bringing these two concepts together, we bring in another common quote that relationships grow at the speed of trust. And so, we'll work to build that trust and build those relationships over time. As we move into the next domain, we want to make sure that we're developing a shared vision and strategy. Let's start by making a vision statement. The coalition should collectively create a shared vision that articulates the long-term objectives and desired outcomes. This vision should be broad enough to encompass the diverse interests of coalition members. And then thinking about, well, what is that strategic plan? Developing a clear, actionable strategy that really outlines specific steps to achieve the coalition's goal. This plan should include timelines, responsibilities, and milestones to be able to track progress. This will need to be developed with clarity so it can continue to live as the coalition moves forward and the strategy adapts. Next is being able to clarify what those roles and responsibilities are. First, by defining a leadership structure. Successful coalitions often have a leadership or coordinating body to manage logistics, being able to facilitate meetings, and guide the overall direction. This can be a steering committee or a rotating decentralized leadership model. A decentralized leadership model is a system where decision-making, responsibilities, and power are shared among multiple individuals or groups rather than them being controlled by a single leader. In youth and teens-led spaces, this structure really allows for collaboration and inclusivity and shared ownership, making leadership more accessible and more empowering. And so what does that look like? Well, shared decision making, instead of one person making all the decisions, leadership is distributed amongst different youth members or members of the team. The collaboration over hierarchy, where everyone has a voice, and leadership is based on skills, interests, and contributions, not that rank or title. Having that flexibility and adaptability where you can really rotate roles, where they can take on leadership when they're ready and step back when needed, allowing for a dynamic and supportive environment. Having that empowerment and inclusion, where more young people are engaged in leadership, ensuring that diverse perspectives are represented. Having community and peer support, where we're encouraging mentorship, teamwork, peer-led initiatives, rather than that top-down control. A decentralized leadership structure empowers youth by sharing power. valuing all voices and building leadership in an inclusive way. It helps teams develop confidence, collaboration skills, and long-term leadership abilities that creates a stronger and more engaged community. And then there's delegating tasks, assigning roles and responsibilities based on the strengths and the resources of each member. Some may handle communication, while others focus on fundraising, organizing events, or perhaps even legislative advocacy. Leverage those resources. Pooling resources together, coalition members should share resources like funding, information, networks, and tools that really help to maximize their collective impact. This could involve combining research, using other individuals' platforms to amplify the message, or sharing office space. Don't be afraid to share that expertise. Each member brings unique skills or expertise to the coalition. This collective knowledge can be used to create better strategies, enhance what the message is, or more effectively, target decision makers. Our next domain is looking at creating inclusive decision-making processes. How do we do that? Well, consensus building. Making decisions collaboratively to ensure that all voices are heard, but also that all voices are respected. This can help avoid power imbalances where certain organizations or individuals dominate the conversation, but also having transparency. Maintaining that transparency in decision-making to build that trust and accountability within the group. Members should feel included and informed about the coalition's progress and the challenges that may arise. Which leads us to coordinating advocacy into action. What is that unified message that we're going for? Coalitions are most effective when they communicate a consistent, unified message. They develop those talking points, press releases, and outreach materials that reflect the coalition's goals and values. And building coordinated campaigns. Organize collective action such as petitions, public events, rallies, or lobbying efforts where coalition members work together to really amplify their impact. This can involve coordinating days of action, community forums, or social media campaigns. And so, how do you handle conflict and challenges that may arise? Conflict resolution. There will be differences in priorities, methods, or opinions are inevitable within coalitions. It's essential to have conflict resolution mechanisms in place, such as mediation or facilitated discussions, to be able to address those disagreements in a constructive way where everyone feels heard. Being flexible within this domain is important. Be prepared to adapt and adjust the coalition strategies or goals based on member feedback, changing circumstances, or new opportunities that may arise. And as we look into our next and final domain, sustaining that engagement. A lot of times we do a lot of the work, but we don't celebrate the wins that we have, even if they're small. Celebrate both those small and large victories to really maintain that momentum and that morale. Recognize that the process keeps members engaged and motivated to continue working towards the long-term goals. And it's okay to have continuous recruitment. Keep growing the coalition by recruiting new members and organizations, and expanding the coalition really ensures that it remains dynamic and can adapt in evolving challenges that may arise. Let's evaluate the process and the impact. Track the progress. Use measurable indicators to evaluate the success of coalition activities. We want to regularly assess whether the coalition is moving closer to its goal and whether improvements can be made. But also create feedback loops. Create a mechanism for coalition members to be able to provide feedback on the process, on the strategies and direction of the group. This ensures continuous improvement and responsiveness to the needs of the group as you move forward. And this is how we build long-term sustainability, because we built that infrastructure. As the coalition grows, formalize its structure by creating those bylaws, forming committees, or establishing a nonprofit entity if necessary. And this can really help with long-term sustainability and fundraising. The leadership development, it helps to develop those future leaders within the coalition to ensure that it continues. offer up training, mentorship, or opportunities for emerging leaders to really step into leadership roles over time, and then create that long-term vision. Think beyond the immediate goals of the coalition. Consider how the coalition's relationship and collective power can continue to influence change on related issues in the future. Here are just some examples of some successful coalition building that include the Healing City Act in Baltimore in 2020. Youth helped to really drive efforts towards trauma-informed change for a statewide healing framework. The Climate Justice Coalitions, which is a youth-led movement like the Friday for Futures or coalitions like the Climate Action Network, where they gather diverse stakeholders, youth, activists, environmental organizations, scientists, really coordinate action and advocate for systemic change related to climate policy. There have also been other successful coalitions that you may have heard about, such as the Civil Rights Movement Coalition. And during that Civil Rights Movement Coalition, organizations such as the Southern Christian Leadership Conference, the NAACP, the Student Nonviolent Coordinating Committee also formed coalitions to help fight for racial equality, leading to significant legislative changes. There are many key elements when it comes to building a successful coalition. We mentioned some previously within the 4 different domains, which include diverse membership, which is a range of voice and experiences to broaden perspectives and strengthen advocacy efforts. 2, clear common goals, a shared purpose that aligns diverse interests towards a specific change. Collective action, coordinated efforts that leverage the strength and reach of each member. Building those strong relationships where trust and open communication among members that foster that collaboration. And adaptability, the ability to respond to internal or external changes while maintaining focus on those long-term goals. In essence, coalition building is about uniting different entities to create greater influence and impact so they can achieve certain goals, but also empowering individuals for movements for systemic change. Next, we will begin to discuss how communities can help impact coalition building. However, I know that was a lot of information. So let's first take a moment to have a deep breath, and then I want to get some feedback from all of you with an activity. Let's take about 5 minutes here, and we'll place you in the breakout rooms to discuss the following question given on the screen. What does it mean to be part of a group? Or how do you think group engagement can help drive coalition building? We'll pause the video here and give you time to discuss and then share out amongst the group. Okay, and now we're back. This part of the module, we're going to talk about the social ecological model with schools, homes, and community. Trauma-informed building involves creating supportive networks that recognize and address the impact of trauma on individuals within schools, within homes, and within communities. This approach integrates trauma awareness into policies, practices, and culture, and being able to foster environments where individuals feel safe, supported, and empowered. Here's a sample look at how this can be implemented in each of these settings. The responsibility for well-being is often placed on individuals and families without considering the broader context. Both individuals and communities can experience ongoing stress and adversity, leading to predictable patterns across populations and generations. Thoughtful policies can help shape conditions that support the community's well-being. So as we continue to move more to coalition building by discussing the impact of trauma and what it looks like in different settings, such as at schools, homes, and the community, we should work towards a systemic approach to prevent trauma and foster resilience rather than just treat health and social problems when they arise. Coalition building across sectors is important to work towards building resiliency and building trauma-informed holistic care system. Take a moment to look at the different petals on this slide. Some of you may have experienced none of the items listed, while others may have experienced one or many of them. Hopefully, no one has experienced all. But if you have experienced any, you may feel that no one understands what you're going through, or you may not be able to express how you feel when faced with these challenges. A number of coalitions form from an individual or individuals who have faced some type of trauma that impacted them to act on. I myself have been impacted on trauma, which created space for me to build a coalition and get into advocacy, which we'll discuss next. Trauma-informed programs and services have to be broadly, systemically, and equitably delivered in our communities to be able to mitigate the effects of trauma. Take a look here on this slide. It talks about primary prevention, secondary prevention, early intervention, as well as treatments. Particular sources of trauma include inequalities, lack of social support and opportunities, community violence, and other adverse social detriments of health. In order to minimize these sources of trauma and others, coalitions in every community must play an integral role in informing mindsets, changing systems, and reforming policies nationwide. The movement to prevent trauma and foster resilience is designed to direct national attention towards the need to create a society that offers every individual, family, and community a safe, non-threatening, stable, and nurturing environment. Coalitions unify advocacy voices by bringing together actors who are united by policy core beliefs and seek to translate those beliefs into policy. Just as with grassroots engagement, coalition building spans across multiple sectors. The fish diagram shows how collaboration with others can help take on issues that one person may not be able to handle alone. With coalitions, we are consolidating our power in support of a specific issue. Certainly, groups may tend to have more influence in individual efforts and policy change, yet these social issues we've been working on are just too large and too complex for any one organization or group to tackle. Building coalitions of groups and individuals that help reach those silos where we are working in isolation of each other and not necessarily achieving our goal. Coalition building is used for being able to create sustainability because the focus is on the common goal and no one single group carries all the water, which means individual groups' efforts can really help bring back that dynamic and rhythm without necessarily disrupting the overall efforts of the coalition. While the diversity of perspective and expertise in coalition is often unparalleled, and the increased access to networks when a coalition is doing this work, it's also important to note that groups do generally come to the table with different assets, different missions, perspectives, priorities, relationships, and strategies to work on collaboratively toward a common goal. So sometimes the groups making up the coalition do seem to have some conflict. For instance, selecting policy priorities can be challenging for coalitions with diverse membership. You might therefore consider developing guidelines to facilitate the decision-making process used to identify and select policy priorities. This might look like collaborating by deciding jointly when one organization will take the lead in a campaign and others will provide support, or by actively seeking out groups that have unique and complementary strengths to help the group as it evolves. It also helps to have a mutual understanding where each organization shows and allows that flexibility for each partner to achieve its mission and goal and purpose through its own organizational structure when possible, and respecting each group's autonomy and culture. It's okay to not agree on everything. And coalitions are not permanent, so while you may agree with organizations on one particular issue, you may not share priorities in other policy areas, so you don't have to work together forever. Next, we'll begin to dive into 3 different types of coalition building for schools, home, and the community. Trauma-informed coalitions for schools start with establishing safe and supportive environments, collaborative and inclusive practices, and comprehensive support systems. Schools can provide positive experiences and support for youth and families, but additional trauma-informed initiatives are needed in the community and across sectors to fully prevent and heal trauma. As we mentioned before, we hope that this guide supports action on specific areas that impact youth lives and youth advocacy that can be helpful. One such example is trauma-informed schools, where we know that our systems can broadly what they can be doing better and being able to promote that well-being through the development of trauma-informed environments with young people that have had that lived experience and expertise as service users, being able to build those trusted voices and being able to shape that action that's needed. As we look at trauma-informed schools, the definition, how it works, and implementation. We want to create trauma-informed schools that include and promote psychological safety and prioritize the model from the top, where staff receive training to better understand trauma-related science, regulation skills, and therapy versus therapeutic intervention. We want to make sure there's an ongoing conversation about what is working and what needs to be improved. We want to build that relationship development and maintain the values created as a whole in support of the community. The behavior is viewed as an adaptive way of communicating unmet needs rather than as an act of defiance. So we want to make sure that we take appropriate measures to repair and make sure that no harm is done and that there's no punishment. Instead, there's restoration. This is just one example of where youth advocacy can be so powerful. As I mentioned back in Module 1 in my own advocacy story, the child welfare system is a place where we've seen growing youth advocacy. And there are other opportunities from community to climate to other systems that all of you can support. We hope to inspire and support you all to take action where you feel passionate and where you see those opportunities needing to take place. Next, safe and supportive environments for students. But how do we create these spaces where they are non-existent? Well, first, we start by training professional development, educating those teachers, administrators, and staffs about the effects of trauma and how to recognize the signs. Training should include strategies for creating trauma-sensitive classroom and interacting with students in a supporting manner. Establish consistent schedules and routines to help students feel more secure and reduce their anxiety related. There should be collaboration and inclusive practices where students have voice and choice. Encourage students' input in creating classroom rules and activities. Provide choices that can empower students and help them feel like they're more in control. Even that peer support programs. Implement peer mentoring and support programs where students can connect with others who understand their experiences and those challenges that they might face. And having that comprehensive support system through counseling and mental health services. Ensuring access to school counselors, psychologists, social workers who are trained in trauma-informed care. And also family engagement, involving families in the education process, offering workshops and resources on trauma-informed practices and how they can support their children at home. We want to make sure to have that family engagement and provide resources on trauma-informed practices. So we next will discuss what a trauma-informed coalition looks like while at the home. First, it starts by building safe and nurturing relationships. By providing parental education, providing parents and caregivers with information about trauma and its effects. This can include workshops, support groups, resource materials, and having positive communication, encouraging open and honest communication with the family. Teach active listening and empathetic responses to really help build that trust and understanding. Next, create a stable and predictable environment. Maintaining those regular daily routines to provide a sense of stability and predictability for youth. And providing those safe places as well by designating a calm and quiet area in the home where children can retreat to when they feel overwhelmed. But also having access to resources and support. Those community resources. Connecting family with community resources such as mental health services, support groups, and recreational activities. And having that supporting network and being able to foster that sense of community among parents and caregivers and encouraging them to share their experiences and strategies for supporting traumatized youth. So we've talked about both schools and homes. And so lastly, we'll briefly touch on Trauma-Informed Coalition for Communities. Take a look at the picture on the slide. Over time, communities have come together and built resilience for the trauma that has impacted them. Although these were not the only factors you will see listed, a number of items, however, impact the community that has allowed them to help build up that resilience. Three of the things that we're going to discuss for this section are community needs for a trauma-informed culture, collaborative networks, and policy and advocacy. And so fostering a trauma-informed culture through community education, raising that awareness about trauma and its impact through community workshops, seminars, and public campaigns, training those service providers, ensuring that all community service providers, including healthcare workers, law enforcement, and social service agencies, receive training on trauma-informed practices. Collaborating and building those networks. Those interagency collaborations help to promote that collaboration amongst different community agencies to provide comprehensive and coordinated support to individuals and families that are impacted by trauma. Those community support groups help to establish support groups for individuals affected by trauma by providing a safe place for sharing experiences and accessing that peer support. And then finally, policy and advocacy, which we'll get more into in other modules, but advocacy for trauma-informed policies or the implementation of trauma-informed policies at all the local, state, and national level. This includes policies related to educating, healthcare, housing, and social services. And hopefully, being able to have funding and resources. Securing that funding and resources to really support trauma-informed program and initiatives within the community. And so how do you build a coalition of youth? Bringing personal and community lived experiences together. Youth from different racial, cultural, and socioeconomic backgrounds experience trauma in different ways, such as systemic racism, immigration challenges, discrimination, or community violence. Their firsthand experience helped to shape trauma-informed policies that are more inclusive and responsive to the needs of all communities. By sharing these stories, they help break those stigmas and normalize conversations about mental health and about healing and what that looks like. We continue to build a youth coalition by advocating for the representation and cultural sensitivity. Young people highlight the need for cultural, competent mental health resources, ensuring that trauma-informed care is no one-size-fits-all. They advocate for safe spaces and culturally responsive healing practices, such as Indigenous healing traditions, faith-based support, gender-affirming care. They help organizations recognize the impact of historical and generational trauma in different communities. Third, is challenging systems and bringing new solutions. Youth question outdated systems, such as in education, healthcare, juvenile justice, and they push for policies that really help reflect real-world challenges. They bring fresh ideas and technology-driven solutions, such as online mental health resources, peer-led support group, and social media advocacy. They help shift institutions from a punitive approach, such as school discipline or dealing with law enforcement, to a restorative and healing-centered solution. Creating those peer support networks. Young people trust and relate to their peers, making them powerful advocates for trauma-informed peer support programs. They help design youth-friendly resources such as mental health apps, podcasts, and social media campaigns that feel accessible and relatable. They provide mutual support and help reduce the isolation that trauma can cause. Promoting awareness in trauma is important for youth when building coalitions. Many young people recognize the overlapping layers of oppression and adversity, such as dealing with race, gender identity, disability, socioeconomic status. They highlight the importance of acknowledging multiple identities when addressing trauma. And so by advocating for intersectional approaches, it can ensure that trauma-informed care is equitable and inclusive for all youth. Young people are not just recipients of trauma-informed care, they are leaders and being able to reshape it. Your diverse perspectives, your lived experience, and innovative ideas make trauma advocacy more inclusive, effective, and responsive to real world needs. And so by listening to you, we're hoping to empower you and create stronger and more healing centered communities. Let's wrap up what we've learned today. Trauma-informed coalition building in schools, homes, and communities involves creating environments that prioritize safety, trust, collaboration, and cultural sensitivity. By integrating trauma awareness into policies and practice, these settings can really provide comprehensive support that promotes that healing, resilience, and empowerment for individuals affected by trauma. Through education, collaboration, and advocacy, communities can work together to build a trauma-informed society that really helps to foster that well-being and recovery. We'll discuss more of this as we go into Module 3. We want you to sit back and do some reflection. What are your experiences with groups? What made you feel welcome? What do you want to see happen? And what specifically does the group want to do? As we're closing this module, I want you to sit back and reflect and have a conversation on what that looks like. Our next module, we'll talk about what is your role as an advocate. Thank you.